This video will discuss colonoscopy, which is a procedure where a thin and flexible tube is inserted into the anus and advanced to the entire large intestine. During the procedure, the entire length of the colon and sometimes the last part of the small intestine called the ileum is visualized. This video will discuss the preparations before the scope, what to expect during the scope, and the recovery period after the scope. Let's first discuss what happens before colonoscopy. Share with the doctor all the medical conditions that one is suffering from. Share if there are any allergies to drugs or a history of asthma. Share all the medications one is taking. This slide shows what are the medicines to stop before the procedure. Always seek the advice of your doctor before stopping these medications. In particular, one should share if they are on any blood thinning or anticoagulant drugs. On medical advice, these medications may need to be stopped for a few days before the colonoscopy, as otherwise it is not possible to take a tissue or remove a polyp. The patient is requested to sign a consent form where the procedure and risks involved are explained by the doctor. An explanation on the alternative procedures or investigations that are available will be given. It is suggested that the patient freely discusses any queries they have. The patient is advised to only sign the consent form if they understand what the procedure entails, risks involved, and the alternative procedures available. The patient should ask a relative or friend to accompany them home after the colonoscopy, or to seek the services of a ride-hailing company, as the effects of the injection, which are given to relax during the scope, can last for the rest of the day. The colon needs to be cleaned before the procedure. The doctor or nurse will give advice on how to clean the colon. A low-fiber diet for at least 2 days before the colonoscopy is recommended. This slide shows the high-fiber foods and colored beverages that have to be avoided 2 days before colonoscopy. It is advised that colored beverages with the colors red, blue or purple be avoided because it could be mistaken for blood during the examination. Foods to be avoided include lentils, fruits and vegetables, nuts and seeds, high-fiber cereals, colored beverage, and fiber-enriched beverages. This slide shows the low-fiber foods that are recommended 2 days before colonoscopy. This slide shows you what happens 1 day before the procedure. The low-fiber diet can be continued for breakfast and lunch on the day before the procedure. However, the low-fiber diet must be stopped by 1 p.m. After 1 p.m., only clear fluids can be taken. This slide shows the two commonly used preparations to clean up the colon. Some doctors prefer to use a laxative called Picoselex, while others prefer to use a laxative called PEG. The top part of the slide shows the preparation with Picoselex, while the bottom part shows the preparation with PEG. These laxatives are given in a split dose, meaning half the medicine is given on the day before the procedure, while the other half is given in the morning of the colonoscope. Details of the colon cleansing procedure will be given by the nurse or doctor. After taking the laxatives, one will purge many times that evening. The exact colonoscopy preparation instructions depends on the bowel preparation the doctor selects, the time of the colonoscopy, and any previous experiences with preparations. If the colonoscopy is in the afternoon, the preparation using laxative can start in the morning. Avoid juices you cannot see through, like tomato, orange juice, milk, and no red, blue, or purple colored items. To make PEG more palatable, chill it or add lemon and sip it with a straw. Keep KY jelly, Vaseline, or diaper cream if you experience anal irritation. A clean bowel is indicated by urine or watercolored stools. This slide shows you the type of clear fluids that are recommended to be taken one day before the colonoscope. Avoid red, blue, or purple colored liquids, as this may be mistaken for blood during colonoscopy. What happens during colonoscopy? The nurse or doctor will insert an intravenous line in the hand to later inject a medicine through it for relaxation and sleep. Oxygen may be given through a small plastic tube that is inserted into the nose. Monitoring devices for blood pressure, heart rate, and oxygen are attached to the hand and arm. The patient is asked to lie on the left side during the procedure. Next, the doctor will give the sedation through the intravenous line in the hand. One will feel relaxed and slowly go to sleep. The scope will be inserted through the anus, and the procedure will take an average of between 15 and 30 minutes. It could be longer if there are many polyps to be removed. During colonoscopy, a small piece of tissue called a biopsy may be taken from the colon. If a polyp is found, it is usually removed using instruments like snares and biopsy forceps that are passed through the scope. There will be no pain during the biopsy or when the polyps are removed. Because of the sedation medication, many patients are generally unaware of what is going on and do not remember anything when they wake up. Let's now discuss what happens after the colonoscopy procedure. What happens after colonoscopy? Observation is for 2 to 4 hours until the sedation wears off. Eating is allowed once the sedation wears off, which is usually after 2 hours. However, sometimes fasting is continued if there are further tests like a scan. The findings of the scope will be explained by the doctor before discharge. It is strongly advised that the patient does not drive or operate machinery for the rest of the day. One should get a responsible relative or friend to accompany them home or call a ride-hailing service. Do not use public transport. It is okay to have normal food for the rest of the day. However, sometimes a liquid diet is recommended if a large polyp has been removed. It is urged that the patient rests at home for the rest of the day. It is okay to go back to work and drive the next day. What are the side effects of colonoscopy? Bloating of abdomen with cramps is common, and there is relief after passing gas. Nausea due to the effect of the sedation. Some blood in the stools for a day or two, especially if a polyp has been removed. The effects of sedation can sometimes last for a day. Thank you.